gastroesophageal reflux and in infant very common and I will say physiological phenomenon. So many of the times parents come to me that child is having spitting, child is having so much reflux, and how can we stop it? How can we prevent it? Or some of the parents are very clear about it. Okay, my baby is born and he may develop reflux. Tell me something. How can I prevent it? So first of all, we need to know that gastroesophageal reflux is a physiological phenomenon. It is like you say how to prevent gastroesophageal reflux. It is like I want my child to walk, but I want he should not fall. So of course, this is a process. This is a developmental process. These things happen. So what happens in gastroesophageal reflux is like your baby will take the milk, and after that, when you are burping the baby, or after that, small milk can come up in mouth or small spit up can be there. So that is what we call as gastroesophageal reflux, which is present in most of the babies and which is a physiological. If your baby is gaining good weight, he is active, he is taking the feeds happily and sleeping after that, and he's sleeping well 2 to 3 hours after taking feed, not vomiting a large volume of milk, then you don't need to worry about it. Most of the times the reflux will peak at 4 months, then it will start reducing. By 6 months or 1 year, most of the kids outgrow this gastroesophageal reflux. Now the worry is what we call gastroesophageal reflux disease. The word disease we add when we feel that our kid is not gaining enough amount of weight because of this spit ups or vomiting, or feeding is a painful process so he is avoiding to take feed, or because of recurrent vomitings he is developing respiratory issues, that he is vomiting and he is aspirating, which is going into lungs leading to cough and respiratory issues. So these are the, or many of the time kids after taking feed arc back like a bow, I will say arc back, that they try to avoid the acid coming up in the food pipe. That is an indirect evidence. If it is happening too much, all these things can say that probably there is gastroesophageal reflux disease and you may need to meet a doctor. But what can we do at home? First of all, I will say feeding. Whenever you are feeding the baby, either direct breastfeed or bottle fed, latching should be very proper when giving direct breastfeeding. There should be, if you just see the information, the right information of latching, and also that too much air child doesn't swallow, latching should be good. After giving the feed, there should be proper burping maybe for 5 to 10 minutes. Then if child is having too much vomiting, you can keep 30° up while baby is sleeping. You can just keep the head end up while baby is sleeping. These are the 2-3 things you can do while baby is on breastfed. On top fed, you just take care that when baby is taking feed, again too much of air baby is not taking while taking bottle feed, that you need to take care. So that is one thing. And proper feeding, proper positioning, proper latching, burping after that, you can keep 30° up. When the baby is older, I will say maybe 3 months, 4 months or beyond 4 months, then sometimes we may try feed thickening. But I will not suggest you to do it yourself, that how should you thicken, how much you should thicken, does your really kid needs it or not. You should always discuss with your pediatrician or pediatric gastroenterologist. Does your child really need feed thickening, or it can get better? If he's on improving trend, maybe it will get better. Or the reflux is very bad, then your doctor may prescribe it. So for gastroesophageal reflux disease, we need to know as a parent, is it just GER or GERD, the disease? If it is disease, we may need to do few small things like changing in the feeding, burping, positioning. Maybe your doctor may advise some medications also to prevent it or control it. If it is simple GER, please do not do so many things. Definitely you meet your doctor to understand it exactly. Are you missing something? But most of the time it should resolve by itself.